We looked at the outcomes on about 200 patients who were treated on both studies, and we found some interesting things. So for example, when you look at overall survival, the median overall survival on the phase 1 and 2 trials was 22 months. But now looking out with over 48 months of follow-up on both trials, if you look at the number of patients alive at 4 years, approximately a third of patients were alive at 4 years. And on the phase 1 trial, where we have 5 years of follow-up, a third of patients were alive at 5 years. Compared to what we were dealing with 5 and 10 years ago with kidney cancer, that's pretty encouraging data. Now it's single arm, very well selected patients, so we can't get too excited, but then we started comparing what we saw in subsets of patients on those trials to what we saw in the phase 3 trial. And on the phase 3 trial, we saw improvements in overall survival regardless, for example, of prognostic criteria, the Sloan-Kettering criteria. So we looked at some of those clinical characteristics as it relates to long-term outcome on the phase 1 and 2 trials, and we found that both Memorial Sloan-Kettering prognostic group, initial response, or performance status didn't seem to predict patients who would be out 4 years and alive, meaning we saw survivors of over 4 years in all subgroups, which was very interesting to us. You would think that there wouldn't be as many in patients who had poor risk disease or had progression as their best response or reduced performance status. But one of the exciting things potentially about PD-1 blockade with Nivolumab is this might have impact on a broader range of patients. But obviously we need to look at it in the phase 3 trial. We need more maturity of that data. So we'll look at similar endpoints in the future with the phase 3 trial.